Hi there. In this video, we are going to discuss another hallmark of carcinogenesis, which is sustained angiogenesis. So we know that tumor cells are basically an abnormal mass of cells which continue to grow, and for its continuous growth, it requires oxygen, it requires nutrients, as well as it needs to remove its waste products. So for all that purpose, it needs continuous blood supply. However, we know that as a size of tumor will continue to increase, when it will be increasing, its demand for oxygen and for nutrients will grow, and it will also need more blood supply to remove its waste products. So, tumor growth requires angiogenesis or formation of new blood vessels which can supply it more and more blood. Okay, so tumor can grow only to 1 to 2 millimeter in diameter by already present blood supply. After that, it will be needing increase in blood supply. So angiogenesis or increased blood supply basically depends upon two kinds of factors. One are pro-angiogenic factors and other are antiangiogenic factors. And these the balance between these factors actually determines that new blood vessel will be formed or not. However, the new blood vessels which will be formed are usually dilated and they have abnormal connections, and they also contribute to the metastasis. So, new blood vessels are not only necessary for tumor growth but also contribute to the metastasis. And these new blood vessels are formed under the influence of pro-angiogenic factors, which include insulin growth factors and platelet drive growth factors. And another important enzyme which plays role in the balance between pro-angiogenic and anti-angiogenic factor is protease enzyme, and these factors can be released by tumor itself, or they can be released by strobel cells, or they can be released by the inflammatory cell which include macrophages and so on. Okay, so principal way by which blood vessels are increased and this balance is shifted from anti-angiogenic factors towards pro-angiogenic factors involves the transcription of vascular endothelial growth factor, which leads to the formation of new blood vessel or angiogenesis. And how this factor is released and its transcription is increased, basically hypoxia stabilizes a transcription factor which is HIF1 alpha factor, and this factor goes to the nucleus and increases the transcription and translation of the VEGF factor, which promotes angiogenesis. Moreover, we know that tumor have the mutation in TP53 gene, and as a result there is down regulation of the P53 protein, and this down regulation P53 basically normally it decreases the level of VEGF factor. However, when P53 is mutated, its levels are down, and when its levels are down, there is alternatively increase in VEGF, which lead to angiogenesis. So TP53 mutation in cancer cell decrease P53 protein, and decrease in P53 protein increases VEGF factor or vascular endothelial growth factor. Okay. Moreover, P53 also normally encodes an anti-angiogenic factor which is thrombospondin 1. Okay. When P53 is mutated, this angiogenic factor is also down regulated. So ultimately, this balance is shifted towards pro-angiogenic factors in cancer cells. Moreover, we know that cancer cells also have a mutation in the RAS pathway, and this mutation in RAS pathway leads to the increased expression of MYC protein, which stimulates the growth, and this MYC amplification also promotes the increased transcription and translation of VEGF, which promotes the angiogenesis. So basically, three principal factors we have discussed here. Hypoxia stabilizes HIF1 factor, which increases the transcription of VEGF. Hypoxia is induced by growing tumor because the blood supply is reduced and the cell don't get sufficient oxygen. And moreover, the P53 mutation is present in cancer cell, and this P53 mutation leads to its down regulation. As a result, VEGF factor is upregulated. Moreover, this P53 also leads to the production of thrombospondin 1, which is an anti-angiogenic factor. When P53 is mutated, this anti-angiogenic factor is also down regulated. Moreover, cancer cell also have RAS mutation, and this RAS mutation leads to the amplification of MYC, and this MYC also increase VEGF transcription and translation. So all these factors contribute collectively toward angiogenesis, and new blood vessels are formed, and these new blood vessels contribute to increased tumor growth, as well as they can respond can lead to the metastasis. So if in some way this vascular growth is targeted and reduced and angiogenesis inhibited, there is possibility that tumor growth can be restricted. So therapies have been devised. One is bevacizumab, which is a monoclonal antibody. It can block the VEGF and can reduce the angiogenesis. However, the result of antiangiogenic therapies have not been much successful. There is some way through which tumors escape the therapy targeting the angiogenesis. However, this is the topic of detailed research and demands a thorough research how they escape through these therapies which lead to the therapeutic failure. So it was all about today's lecture. Thank you.